at this exceptional time. Freedom was hard won in our country, and it jars with us to restrict and limit individual liberties, even temporarily. But freedom is not an abstract concept. We give it meaning every single day, in the way we live our lives and the decisions we take willingly to protect our loved ones and colleagues. So I'm asking people to give meaning to our freedom and liberty by agreeing to these restrictions, restricting how we live our lives so that others may live. I'm asking us for a time to forgo our personal liberties and freedoms for a greater cause. And I'm appealing to every man, woman, and child in our country to make these sacrifices, not out of self-interest, but for the love of each other. To begin each day knowing that every single imposition, every single inconvenience, every irritation, every lost opportunity will save lives and help our health service to cope. The whole world is suffering during this pandemic, and Ireland is no different. What happens next is up to each and every one of us. So show your support for our healthcare staff. Show your support for everyone who's working in essential services or looking after vulnerable citizens. Show that you care for your families and friends. Stay at home. Tá dawan omláin ag folingt, agus níl éireann difriúil. Is gach aine inis cad a tarlóig. Tá spáin de cuid tacaíocht dibreathirí sáintiúla. Tá spáin de cuid tacaíocht don seirbhísí riachtanach agus daoine atá lag chuidú. Tá spáin go feici tú ina dhia de clown agus de chóirde. Fan bhaile. Gur maigad.
Thank you, Taoiseach. Last night, you all stood and applauded our frontline workers, the people who are putting themselves in harm's way day in, day out to keep us safe. Tonight, we're asking you to stand with them again. They are staying in work, so we need you to stay at home. We have become so aware of what's happening in the rest of the world during this global pandemic, but our personal worlds must now shrink again. And I know you must be asking yourself, what's next? But in the face of a crisis where we know the actions we can take as individuals can make all the difference, we have to constantly ask ourselves, can we do more? And we can, and we will. We must stay home in all but the most limited circumstances that the Taoiseach has outlined. You must not gather in public or private outside your own household. Older people and those we identify as particularly medically vulnerable must stay home altogether. And we will have to help them do this. We will help them as a government, and we will help them as a community. I know this is already so strange and so difficult, and it's not going to get any easier in the days ahead. But we have to take the further measures advised by our public health experts to give ourselves the very best chance of reducing the impact of this virus and saving lives. It has been a shock to many of us to see the number of deaths grow in recent days. This is the reality that we face. This is the now that we are living in. So we have to accept these temporary but difficult restrictions now in the hope of better times ahead. The time will come again where our life goes back to normal, when the distance we now have to put between us can fall away. And when that time comes, we believe we will be able to say to each other, we did all that we could to save lives and protect our country to the very best of our abilities. So many people have been kind enough to send words of encouragement and solidarity to those working so hard in my department. And one I read today had a quote from Victor Hugo on the front. It said, "Even the darkest night will end and the sun will rise. If we endure now, we can hope to see that sunrise sooner. If we make these intense and difficult changes now, we may not have to live with them for as long as we otherwise would. But we need to stay the course, and put simply, we need to stay at home."
So we have, in the National Public Health Emergency Team, since late in January, put preparations in place and begun to track this virus as it moved around the world, as it appeared in this country. And at a number of stages throughout the course of this, we have come to government asking for measures, and measures that have been implemented, that societies had to bear and societies had to work with us to implement. We think we see signs that are encouraging us that this is helping, but we think we need to go further. The signs that are telling us that this is helping, first of all, we've seen over the course of recent weeks a drop in the number of contacts associated with each case that we identify and that we follow up in contact tracing. This gives us encouragement that the public is working with us. We've also seen that the day-on-day increase in the total number of cases has slowed down relative to what we might have expected a number of weeks ago. But this does not tell us that the worst is over. It tells us that we're having some early impact. But we're concerned, as I shared with you yesterday evening, that some other measures in relation to the disease, particularly in the context of admissions to intensive care, as the Taoiseach identified, those have continued to increase day on day. And while we think we're still at an early point in the course of this disease, we think now is the time for us to move to strengthen the measures further, to try to spend 2 weeks to really suppress the transmission of this virus as much as is possible in the community. We still see something in the order of 50% of cases identified with no links that can be identified for those individual cases that tell us how that individual picked up that infection. And this tells us that the virus is in the community. And we think in the early course of this infection, with the support that we've had from the public, that with these additional strengthening measures, we can drive the infection back out of the community and more into households, and that we can continue our public health advice to people who have symptoms to self-isolate for 14 days, to make contact with their GP, and that their household contacts isolate with them. We think this measure, when we look at the number of contacts per case, will significantly interrupt the transmission of this virus, which is our objective, and turn the infection, which is a community-based infection, into one that's a household-based infection. And we think that that can have an impact not only in the transmission of the virus, but importantly in the progression that we've seen in the serious infections that have resulted in intensive care admission, and ultimately feeding through into protecting and saving lives as much as we possibly can. And so we've advised again that in respect of this range of measures, that rapid, early, comprehensive, coherent advice of this kind, in line with the advice that we have from the European Centre for Disease Control, is necessary and will help to drive this infection from the community in the way in which I've set out. Thank you.
Taoiseach and Dr. Holohan, it's only 3 days since the last meeting of the MPHET where an escalation of the previous restrictions was recommended. This has obviously come quite quickly. A couple of days ago, you hadn't even intended for MPHET to meet again. Can you underline the gravity of the situation or how it's escalating as to why you felt it was necessary even to convene that extra meeting? And is there any indication at this point that you can say for certain that in 2 weeks you will be able to lift these new restrictions?
So Taoiseach set out some of the measures that we identified that caused us to respond. As I've said, we've stayed very closely watching this disease over its course day on day, and the measures that we've tracked obviously include the total number of cases. We've also identified, and I shared some of these with you yesterday evening, because as we met with you yesterday evening, we did indicate that we were going to meet again this morning because we were getting concerned about the rise in the number of infection admissions to the intensive care units around the country, that we were concerned about the, albeit still a small number, the rise in the number of deaths that we had seen, that we had seen a continuing increase in the number of cases overall, which had doubled over the course of the week, as had the number of intensive care unit admissions. And we had seen, which gives us concern, a number of nursing homes, 10 in the country in total, and a number of other residential facilities, as well as healthcare institutions reporting clusters of infection. And given the vulnerable nature of the populations in some of those settings, and we think all of those measures in combination show that although we've seen some slowdown in the growth of cases overall, some of the other measures have continued to increase. And we think that now, over the course of this week, having seen that data, and you'll be familiar with what we shared with you in the early part of the week, some of those important indicators have more than doubled in the course of 3 or 4 days. And we thought it was not appropriate for us to wait until next week and the next scheduled meeting of the National Public Health Emergency Team to evaluate whether further action was necessary. And for that reason we met this morning, so that we continue our pattern of early and decisive response to the measures and the changes that we see happening in relation to the disease. In relation to 2 weeks' time, it's not possible at this point to predict exactly what will happen over the course of the disease, but our hope will be that by instituting these additional strengthening measures in terms of seeking to significantly reduce as much as possible the transmission of this virus in the community, that we will have the impact that we're seeking to have. And we'll be reporting and evaluating that on a daily basis over the course of those 2 weeks.
Ashton Kenny from RTE Taoiseach and Minister for Health Simon Harris. Can I ask you, is this essentially a full lockdown now? And also, in terms of cocooning, what does this mean for elderly people? What about volunteers and carers who have to visit elderly people? Can that still happen? And finally, just how can the 2 kilometre radius be policed?
Okay, I've always been reluctant to use the term lockdown because it means different things to different people and can mean different things in different jurisdictions. So that's why I don't like to use that term. I prefer to be specific about what we're imposing on people and asking people to do rather than not. But this is very restrictive, really saying to people that they shouldn't leave their homes, that if you go out for exercise, you should do so individually or with your children and not go within 2 kilometre of your house. And then only leave for the essential purposes which I mentioned earlier. There isn't much more beyond this, I think, that we could do in terms of further restrictive measures. In relation to the 2 kilometre radius, that is going to be very hard to police. We have enacted powers that allow the Gardaí to detain people, and we can impose penalties on people who are breaching these rules. But the best way that we can achieve this is by consent, by cooperation, by people understanding why these rules are being put in place to protect themselves, their friends and families from Covid-19, to protect our healthcare staff, to protect our health service from becoming overwhelmed. And I think if people understand that message and buy into it, that's going to be much more powerful than anything that our 15,000 Gardaí can do. But they will be available to police it as needed. Sorry, the final part of your question? Yeah, I might ask CMO to comment on that a bit more, but in terms of where it is allowed to leave your home, that does include carers going in to see elderly people, professional home carers, for example, family carers and so on. So it does include them. They can still carry out the essential care that they've always been carrying out and need to carry out for reasons people will understand. But the concept of cocooning really is that people over 70 who are at high risk and those under 70 with a list of chronic diseases should stay at home and put in place arrangements for someone to check on them, to visit them, to make sure that they have food and medicines, to make sure that they're okay. There's a panic alarm system in place. An Post have kindly agreed to make their postmen and postwomen available to help out with this, and there'll be other actions as well. But I might let Tony maybe fill in a bit more on that.
I think we know this is a significant further ask of people in vulnerable groups, but I think we have good reason to believe, anecdotally and with some of the market research information that we have, that already people in some of these age groups are effectively already doing this, in as much as possible staying in their homes, limiting their contact with other people and minimising it to those people who are involved, as the Taoiseach has said, in providing basic care and support to them in the home. What we'll be advising people is to stay in the home and to follow the detailed guidance which is being made available this evening. It will be made available, published on the HSE and HPSE website, full of detailed practical arrangements for families and for individuals themselves who are cocooning themselves over the course of the 2 weeks. We understand that it is a significant ask of people. That's why the period of time is short in terms of its application. We'll seek to do everything we can to try to support people in the home during the course of that particular time.
Shane Beattie from News Talk. Taoiseach, are you worried about panic buying? We've seen this in other countries. I know you're at a food supply place today. Are you worried about that when people hear this announcement? Whether you like it or not, social media people are calling this a lockdown. And with that, there will be an element of panic buying. Have we any resources in place to stop this? Have you had chats with the supermarket companies? And also in terms of policing it, what are we likely to see on the streets? Will we see Gardaí out on the streets watching how far people are driving, where they're walking to and who they're with?
Yeah, to be frank, I'm not worried about panic buying. We haven't seen that yet in Ireland, and I think that's a good example of us as a nation. And part of what I did today and the work of Minister Humphreys has been to ensure that there is enough food and enough household goods in the country, and there is. We've enough food in the country to feed 40 million people. We've enough toilet roll to meet the needs of people for a long time to come. So the only reason as to why there could be an interruption in the supply chain would be if people engage in panic buying. And then the people who may lose out then are the most vulnerable, the most elderly, and our healthcare workers. But I think, as a nation, we've shown that we haven't done that in the last few weeks. I think most people are probably fairly stocked up now. We're not going to close the supermarkets, so people don't need to be afraid that will ever be part of the measures that we put in place. In terms of policing, we have 15,000 Gardaí. We have obviously the possibility of calling on the Defence Forces if needed, and also the reserves. But the best way to do this is through self-policing and people understanding why we're asking them to change their way of life, to save the lives of others, to protect our healthcare workers, to prevent our health service from being overwhelmed. And I think people cooperating, understanding this, buying into this, will be so much more powerful than any kind of response that we can get from the Gardaí. But they are empowered to act if they need to do so.